If you're experiencing pain, burning, or the urge to urinate frequently, you may find relief with a medication called Urinary Pain Relief. This medication helps to soothe the lining of the urinary tract, providing relief from these uncomfortable symptoms. It's important to note that this medication does not treat the underlying cause of urinary irritation, but it can help to alleviate the symptoms while other treatments take effect. The recommended daily dosage and optimal timing for taking this medication can vary, so be sure to consult with your healthcare provider for personalized guidance. When taking this medication, it is important to take it by mouth after meals, typically 3 times a day or as instructed by your doctor. If you are using this medication in conjunction with antibiotics for urinary tract infection symptoms, or if you are self-treating, it is important not to continue taking it for more than 2 days without consulting your doctor. The dosage of this medication is determined based on your medical condition and how you respond to the treatment. It is important to inform your doctor if your condition persists or worsens. If you experience headache, dizziness, or stomach upset while taking this medication, be sure to let your doctor or pharmacist know. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. While many people don't experience serious side effects, it's essential to notify your doctor if you have any concerning symptoms, such as yellowing skin or eyes, changes in urine, stomach pain, vomiting, fever, or unusual tiredness. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms like rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so be sure to contact your doctor if you notice any other concerning effects. As for the daily dosage and optimal timing, it's important to follow your doctor's instructions. If you have any concerns about the medication or its side effects, be sure to discuss them with your doctor or pharmacist. Before taking urinary pain relief medication, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to the medication itself. It's also important to discuss your medical history, especially if you have kidney disease, liver disease, or blood disorders. This medication can make you feel dizzy, especially when combined with alcohol or marijuana. It's important to avoid driving or operating machinery until you can do so safely. Limit your alcohol intake and talk to your doctor if you are using marijuana. If you have a surgery scheduled, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication can change the color of your urine and tears to orange-red, which may stain clothing and contact lenses. It's best to avoid wearing contact lenses while using this medication, and the color of your urine and tears will return to normal after you stop taking the medication. If you are pregnant, it's important to discuss the use of this medication with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's instructions and guidelines for taking this medication. It's important to be aware of potential drug interactions that can affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be cautious as this medication may interfere with certain lab tests, such as urine tests for kidney function, bilirubin, and sugar levels, which could potentially cause false test results. Make sure to inform your lab personnel and doctors about your use of this drug. If someone has taken too much of this medication and experiences severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include unusual tiredness, changes in skin color, differences in urine output, difficulty breathing, rapid heart rate, yellowing of the skin or eyes, easy bruising or bleeding, or seizures. It's important to remember not to share this medication with others. Your doctor has prescribed this medication specifically for your current condition, and it's not recommended to take it later for another urinary pain-related condition unless instructed by your doctor. In that case, a different medication may be necessary. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take extra doses to make up for the missed one. It's important to store this medication at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes time to dispose of any unused or expired medication, it's best to consult with your pharmacist or local waste disposal company. Make sure not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.